Okay, so for the diagnostics for congestive heart failure, it can be separated into labs and also imaging, but first we're going to talk about the labs. So the first lab that's very important and very relatable to congestive heart failure is the BNP. In this case, BNP would be elevated above 500. So why would the BNP increase? The ventricles are unable to hold a high volume, and what happens is that BNP will be released, therefore increasing it significantly. The next lab we want to trend and monitor is the BUN creatinine. The reason why we would want to monitor that is because due to low perfusion to the kidneys, we will be unable to regulate, the kidneys will be unable to regulate the waste products since it's damaged. So the B1 will be elevated significantly and the CRT will be elevated. Normal BUN is 10 to 20, CRT is 0.6 to 1.2. Now, how about the liver? Same situation as the kidneys. If there's low perfusion to the liver, it's going to cause the liver to not function properly. The AST, ALT, liver enzymes are going to be elevated. AST levels are 0 to 40, ALT is 0 to 50. The liver has a lot of functions, as we mentioned earlier, such as detoxification. Clotting helps in the conversion of bilirubin. That's where a lot of drug absorption occurs. So if the liver is damaged, there's going to be a bigger issue associated with that congestive heart failure. Sodium. Why would we see low sodium? Sodium would be decreased below that 135 because the amount of fluid that's accumulating due to congestive heart failure. The sodium electrolyte is going to be diluted, causing dilutional hyponatremia. The issue behind this is that the patient has a higher chance of having a seizure. So a nursing intervention is placing a patient on seizure precaution, padded side railings, suction at bedside, keeping their airway clear. That's very important to monitor for. It's also important to know that sodium has an inverse relationship with potassium. If sodium is low, potassium is going to be elevated. So it's important to monitor for potassium. Other diagnostic tools that we can use are some imaging. It's important the first one that's very important is considered to be the gold standard for diagnosing congestive heart failure is echocardiogram. The function of an echocardiogram is to help detect the size of the chambers in the ventricles to see if it's hypertrophied or not, or if it's damaged due to the overcompensation of the ventricular walls and the chambers. Another function of it is to detect the ejection fraction. The ejection fraction is the amount of blood that the heart is pushing out. Anything less than 50% is considered to be low. Anything greater than 50% is considered to be normal. So, for example, if a patient's ejection fraction comes out to be less than 50%, it is considered to be left-sided congestive heart failure. If it's greater than 50% and it's normal, it's indicative of right-sided heart failure. Second, we would want to place a 12-lead EKG on the patient to detect any dysrhythmias such as ventricular tachycardia, ventricular fibrillation, atrial fibrillation, a flutter. The reason why we want to monitor these is because increased lactic acid leads to death. These can overall become a stroke or a pulmonary embolism. Okay, so for the treatment for congestive heart failure, there's two separate categories that we can go off of. There's the emergency treatment, and then there's the long-term ongoing care treatment. Right now we're going to talk about the emergency treatment. So there's an acronym called Unload Me, UNLOADME, used for an upright position and upright feet. Upright position is typically for the left-sided CHFer, so they can when they're in upright position, their lungs could expand properly. For right-sided heart failure, the U would be associated with the upright feet and elevated legs. Nitrate is the N. Nitrate, such as nitroglycerin, it's considered to be a vasodilator. What it's going to do is going to cause vasodilation, bring down that blood pressure. Also, its other properties that's going to return oxygen to the myocardium, so that's significantly going to help the patient. L stands for Lasix. It's considered to be a diuretic. Diuretics, especially Lasix, you want to watch out for the low potassium. You want to push it slowly so the patient doesn't develop tinnitus, because the ears and the kidneys are associated with one another. Also, you want to watch out for blood pressure. So if the patient's getting out of bed, make sure that they press the call button. O2 is the O in Unload Me. Nasal cannula must be worn. Albuterol is the A. What that's going to do is going to cause bronchodilation. The patient already has trouble breathing as it is. So what it's going to do is going to relax those bronchioles. Something to look out for an albuterol, it's going to increase that heart rate. It's going to cause jitteriness. That's something to explain to the patient. Also, with their compensatory mechanism, is going to increase their heart rate, increase their blood pressure. So they're going to they might have a little bit of anxiety. The Jobson is a D. What it's going to do is going to help with myocardial contractility. It's going to help the heart push out that blood to the systemic circulation, and try to get rid of that low cardiac output and increase it. Morphine is the M. It's going to assist with returning oxygenated blood flow to the myocardium, to prevent any lactic acid buildup. And E is electricity. That's the worst case scenario. VTAC, VFib could develop from the increased amount of lactic acid from the cells switching from an aerobic to an anaerobic metabolism. So for ongoing treatment for congestive heart failure, there's quite a few of them that we can talk about. First ones are diuretics, specifically Lasix and spironolactone. Lasix, something that's important about that is that potassium will drop, so it's important to monitor the potassium level. If a patient's potassium level is low, the doctor may order a spironolactone because it's potassium sparing. It's going to keep the potassium level regulated. Something important about Lasix is that you want to push it slow to prevent any tinnitus from occurring. Also is that when a patient's trying to get out of bed, make sure you educate them and let them know, hey, make sure you call me before you get out of bed so you don't fall and hurt yourself, because Lasix, what it does, the patient will diurese, get rid of all that fluid, blood pressure will drop. So that could be a fall hazard situation. Second is a vasodilator such as nitroglycerin and morphine. Nitroglycerin, what that's going to do is going to vasodilate those arteries, causing the blood pressure to drop a little bit. Also, what it's going to do, it's going to return oxygenated blood flow to the myocardium to support the myocardium during congestive heart failure. Morphine has the same function as well. Beta blockers, something significant about beta blockers is that you need to make sure whatever the doctor orders is either selective, non-selective. The reason I say that is because if a patient is a diabetic with congestive heart failure, or it is an asthmatic with congestive heart failure, it's going to mask those symptoms. So make sure to know which meds are selective or non-selective. ACE inhibitors, for example, lisinopril, why that's important is the reason ACE inhibitors are important is because it's going to block the conversion from angiotensin 1 to angiotensin 2 by blocking the enzyme ACE that's converted within the lungs. So the issue behind, or some side effects behind ACE inhibitors, is that it's going to cause angioedema, cough, and elevated potassium. So it needs to regulate their diets while in the hospital. Also, the fifth medication are anticoagulants such as heparin and warfarin. So for warfarin, you want to monitor their PTINR. Heparin, monitor their APTTs. Also, if they're on anticoagulants and diuretics or any of these medications that's going to cause low blood pressure, that's going to be an issue, because if they fall, hurt themselves, they can hit their head, causing easy bleeding, dropping their blood pressure even more, possibly even putting them into hypovolemic shock. So that's something we need to monitor for. So another medication that's important as well are inotropic medications, specifically digoxin. Digoxin is a great medication for congestive heart failure because what it's going to do, it's going to provide, it's going to allow the heart to contract properly, which also is known as myocardial contractility. Some side effects of digoxin is hypokalemia, muscle fatigue, and weakness. Something that you would need to monitor for is a low heart rate below 60. If the patient's heart rate is below 60, make sure to notify the physician and see if there's anything else that could be provided. Also, something that's important to monitor for is something called Jobson Toxicity. Some signs and symptoms of the Jobson Toxicity are weakness, arrhythmias, restlessness, nausea, vomiting, and bradycardia. Also, some patients report seeing a yellow halo that could be indicative of Jobson Toxicity. Certain electrolytes could cause Jobson Toxicity, such as a low magnesium level. High calcium levels could be contraindicated with digoxin, so make sure to trend their electrolytes properly, as well as monitor if they're on a calcium channel blocker, because calcium channel blockers could cause issues with the absorption and functioning of digoxin. So as I mentioned before, we pretty much covered all of congestive heart failure. It's going to be separated to part 1, part 2. We covered the pathophysiology, the nursing interventions, diagnostics, and treatments. If you like this video, make sure you subscribe, like, and share. Also leave a comment if you have any questions. And thank you, and have a great day.
Okay, this is a select all question. A 73-year-old patient with left-sided heart failure enters the unit for trouble breathing. What are the signs and symptoms do you expect to find upon assessment? Answer will be available for you on the next slide. Okay, which medication will help control the rate of atrial fibrillation and AFib flutter? The answer will be on the next slide.